Hello students, we'll just see what this image is. We'll have image study today. So what this image is, look at that. There is you can see the pelvis, you can see the L5, 4, 3, 2, 1, this is the 12th rib. You can see the vertebra here, you can see the pelvis. You can see a radiopaque stone is encircled there. You can see pelvis, hip joint, everything. So what this image is, what is the finding? Look at that. So it is a CTKUB. And it is further advancement if you tell it's a reconstructed image. It is the reconstructed CT image of the KUB. KUB is, you know, that kidney, ureter, bladder. CT is the ideal investigation for renal stones. That is the current concept. KUB is kidney, ureter, bladder. It covers the pelvis also for urethral stone. So this is the this is the kidney comes here, ureter is this area, and bladder is this area, urethra is this area. So finally it will be KUBU actually. So it shows large ureteric stone. See that encircled it is, right side, very large ureteric stone. See that, this is the stone actually which we have removed, quite big. So what are the problems with the ureteric stone? Severe colicky pain and reflex spasm, pylospasm and vomiting, hematuria, burning urine, because it causes obstruction, hydronephrosis, obstructive uropathy. So this is the kidney, this is the ureter, this is the bladder. So this stone is here, so it causes the obstruction. So kidney get dilated like that, hydronephrosis. So they have to remove this stone to relieve the obstruction. Otherwise, kidney parenchymal damage occurs, obstructive uropathy. They will develop uremia eventually. Creatinine will become higher. They are called obstructive uropathy by back pressure or obstruction. So may cause infection, pyonephrosis, raised serum creatinine uremia are typical. So management is CTKUB, reconstructed image, I already told. Serum creatinine is very essential. Ureteroinoscopy under anesthesia, spinal usually. From per urethra you pass a scope and identify the ureteric orifice. And you put a ureteroscope, then through the ureteroscope laser or lithotripsy or whatever it is, break the stone and remove. Then that's called URS, ureteroinoscopic. Then laser lithotripsy currently is very useful. Laparoscopic stone removal. So what we did in this very impacted stone, this one. So this was removed by urologist through laparoscopy. So under laparoscopy, identified ureter after movement in the colon, then opened ureter, then removed stone, then place a stent through laparoscopy, then suture the ureter with the 3-0 interrupted sutures, vical actually, polyclinic actually. So J stent should be placed after removal for 3 to 4 weeks, which will be removed then. So after removal of the stone, J stent should be placed, which will be kept for 3 to 4 weeks. And which should be removed after 4 weeks. That's the point. So read about ureter stone, proximal ureter stone, middle ureter stone, distal ureter stone, basketing, URS, proximal most you can do a PCNL, percutaneous nephrolithotomy. You can bombard with the laser. So many procedures are. So classify proximal third, middle 1/3, lower 1/3, unilateral, bilateral. Uremia you have to check, hydronephrosis you have to check. Stone should be removed. That's very, very essential. In any ureteric stone, only small stone you can give drug therapy or diuretic therapy. Otherwise, bigger than 8 mm stone should be removed to prevent back pressure and damage to the kidney as such. So just go through how to read, how to go identify, to clinical examine urinary system and kidney, ureter, bladder diseases, malignancy, everything. Go through my book for entire urology in detail, manual of surgery and approach surgery for different techniques, and begin our lectures through JP for everything as such, gives lectures, everything covering all CBME and UG syllabus and PG syllabus basic also. So students, I hope you understood basics about ureteric stone very clearly. Thank you very much.